my name is Adriana Lopees Victoria, and I'm an MPH candidate here at the University of Connecticut.
I chose public health because I went in as a biology major. I got my bachelor's in physiology and neurobiology at UConn, and I felt that I really liked my classes, but I was missing a very critical aspect of what I want to be learning. In the clinical background, you focus so much on health, as in what health behaviors people are doing and what are they doing to take care of themselves, but you don't really have that aspect of the environment and what structures are in place to make sure that they can make healthy choices and take those behaviors to ensure that they have the capacity to live and be healthy. So I think that I was missing that aspect, and I wanted to explore that a little bit more. And so being at UConn, I was exposed to the FastTrack program, and that really opened my eyes and gave me an opportunity to access this education and this aspect that I was missing in my education. So I did that, and that really opened my doors, and especially as an out-of-state student, it made it a lot easier for me to attain this extra degree and kind of make me a more well-rounded professional. I think the most surprising thing about this program so far has been just the different types of people that I've been able to meet and the diversity within the student body. I wasn't really expecting to meet people from so many different walks of life, both personally but also professionally. So there's a lot of students like me who come straight from undergrad or who take a couple of years off, but then there's also professionals who've had full careers before this, or people who are still, working full-time jobs that they've been at for 20, 30 years and decided to come back to school. And I think that that aspect of the student body and just the way the program is made up really makes it so I've been able to learn not just academically, but also, about life and other aspects that I didn't expect. My professors and classmates have supported my growth in public health through teaching me that I can lean into a community to achieve my goals, because a lot of the time in the past, I've really been very hyper independent and viewed my personal journey and my professional journey as something I had to do by myself. But I've really learned through this program that public health is a community-based effort. And so leaning on my professors to guide me and make me feel seen within the space, but also my classmates, and leaning on them through this program has been huge in cementing myself in public health as a professional, but also just, getting through graduate school. I think the most memorable experience for me in this program so far has been through my practicum. I do my practicum with Health Equity Solutions. They're a community-based organization that engages with community members to understand what they feel their biggest health needs are and work with them and alongside them to advocate for policies that will address those needs at a state level. And so I'm the community engagement and advocacy intern there, and it's been really incredible to use my previous experience in community engagement and in organizing and facilitation to a more public health focus and health policy focus, which is what my main interest is in the field. And it's been really incredible, both to understand and connect with a new community and to see myself grow as a professional in the health policy space. So I've had a little bit of both experiences of both grassroots and grass tops initiatives, and it's really molded and cemented that that's what I want to do in public health moving forward. I think my main piece of advice for someone who would be applying to this program is to come in with a mindset of you get out what you put in. And I think that could be different for different people. So if you already know what your passion is in public health and this is what I want to do, really sticking to that and making sure that you make the most of each opportunity, each class assignment, each conversation with a professor, any avenue that you can get and use to get to where you want to go. But then also, if you are not sure and if you're still exploring this very vast field of public health, to utilize those same experiences, your class assignments, professors, classmates, practicum, all of that, to explore different avenues and really put in the work to, get you a little bit closer to what you want to do and try to figure that out. But it really takes a lot of work, and if you throw yourself fully into it, then it'll be worth it in the end.